Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. MODY versus the type 2 diabetes mellitus. So let's compare both of them. The first one, we look at the type 2 DM, diabetes mellitus. So here the age of onset is predominantly middle to the old age. So it is between the mid to old age. Next is the question arises on the pathology. So upon pathology, there is a beta cell dysfunction. There is beta cell dysfunction as well as the insulin resistance. There is insulin resistance. Now, what about the family history? So under the FH, there is positive inheritance and it is polygenic. Next is there is vertical transmission present. So this vertical transmission is through successive generation. So vertical transmission through the successive generation. So this is not essential for the diagnosis. It is not essential for the diagnosis. Next we look at the insulin dependence. So in terms of insulin dependence, that is non-insulin dependent. It is non-insulin dependent. And looking at the obesity, it's very common. It is common. The DKA is uncommon. The DKA, diabetic ketoacidosis, it is not common. And looking at the serum insulin level, the serum insulin level, so this level will be high. Now let's look at MODY. So here the age of onset is in young, that is less than 25 years, and the pathology, it involves only the beta cell dysfunction. So there is a beta cell dysfunction and there is no insulin resistance. There is no insulin resistance. Now, what about the FH? That is a family history. So in family history, it is positive. So by positive, there is a positive inheritance. That is, it is monogenic as well as autosomal dominant, as well as autosomal dominant. And the vertical transmission is through at least 2 successive generations. So when you look at the vertical transmission, it is through at least 2 successive generations. Now ideally there are 3 is essential for the diagnosis. So question arises on the insulin dependence. So the insulin dependence, the answer here is it is non-insulin dependent. And looking at the obesity, it will be uncommon. So what about the DKA? DKA is again uncommon. The severe insulin levels, this will be again, it will be low. To learn and grow daily like this, please do subscribe.